Good morning, everyone, and welcome to today's webinar, which is addressing mental health for caregivers during COVID-19, which is a joint collaboration with PANCAP and PAHO. I am Sandra Jones, the HIV/STI advisor with the PAHO Sub-Regional Office, and I will be moderating the session today. Healthcare providers are at the forefront of the COVID-19 pandemic, which have caused much sadness, death, and disruption in our lives, and has impacted tremendously on mental health. Now, more than ever, it is important for the health systems to create and ensure an environment, infrastructure, and resources to support physicians, the nurses, and healthcare team members to support the emotional well-being of the caregivers with a focus on the vulnerable caregivers. Today's session focuses on the promotion of the strategies to deal with COVID-related caregiving stresses that can have significant impact on the lives of the healthcare providers as well as on the work. Before I hand over to the presenters and we start the webinar, I would like to take a few moments to review some of the housekeeping tips. First of all, your mics are muted. If you have any questions, please type and submit these in the chat bar of the webinar panel. These will be addressed after the two presentations during the question and answer segment. We are recording the webinar, and the recording will be shared on the PANCAP and the PAHO website, as well as other social media platforms for the benefits of persons who could not have the opportunity to attend the live session, or if there is a reason that you would want to review sections of the webinar. We will also administer 2 polls during the session. We greatly appreciate your participation in the poll. You will also receive a post-webinar evaluation, and your feedback is valuable as it supports improving future webinars. And finally, I would like to share that at the end of the session, you will receive a certificate of participation, and the certificate will be coming from PANCAP. Before we jump into the session and I present the 2 presenters for today, I would like to turn over to Dr. Adams, Executive Director of PANCAP, for just a brief words of welcome. Dr. Adams, over to you.
Good morning. Thank you very much, Sandra. Unfortunately, my camera isn't coming on, it's just spinning. So in the interest of time, let me say, first of all, welcome to everyone to this webinar. As you said, Sandra, that the COVID-19 pandemic, I think by now has affected or impacted many of us who are online and a number of healthcare providers. Healthcare providers, as we know, are at the front of the COVID-19 response. And when we put this in the context of a war, they are the frontline workers, and they are the ones who are fighting this pandemic. They are not only impacted directly in terms of coming down with COVID-19, but the indirect impact of COVID-19 has had tremendous impact on healthcare providers, because the stress, the uncertainty, the fear, and even the burden of being in the front lines have really placed a lot of mental health and psychosocial issues on healthcare providers. At the same time, we require healthcare providers to continue to provide essential and quality care to all of us. And they are also humans like all of us, and I'm sure that this will come out in the webinar today. And so mental health and self-care for care providers is very important. We need to protect and we need to safeguard our healthcare providers, and we need to ensure that they are in a state of mind that they can continue to serve the patients but also that they can continue to be individuals and to serve their families, etc. This is a joint webinar put on by PANCAP and PAHO through a series of webinars that we have been conducting under the Knowledge Management Hub that we have at PANCAP. And so we're thankful for the presenters this morning, and we're hoping that the information shared today will be beneficial to all of us who are online, and that we continue to ensure that our healthcare providers are safeguarded and we rally around and support them. Thank you very much, and over to you, Sanjay.
Thank you very much, Dr. Adams. And I will now like to introduce the two speakers that we have for today. Dr. Claudina Cayetano, our first presenter, is a medical doctor who specializes in psychiatry and has many years of experience in public mental health and in mental health policy formulation and implementation. She currently works as the regional advisor on mental health for the Pan American Health Organization, World Health Organization, which at the office, which is based in Washington, D.C. In this role, she provides technical cooperation to PAHO member states in all matters related to mental health as a public health issue. PAHO has 35 member states in North, Central, and South America and the Caribbean, and 28 country offices. Prior to joining PAHO as a full-time staff, Claudina served as a consultant with the organization, providing technical support to various Caribbean countries on the integration of mental health into primary care, and worked as the director of the National Mental Health Program with the Ministry of Health in Belize. Dr. Cayetano has worked over 30 years. So she has over 30 years of experience in health services and program management. After obtaining her medical degree, she completed her postgraduate degree in psychiatry at McGill University. And our second presenter is Dr. Sharma. Dr. Sharma received his medical degree from India and completed his specialization in psychiatry at the University of the West Indies. He has worked extensively in the Caribbean, and he served as the department chair in the Department of Behavioral Sciences of Ross University School of Medicine. As a consultant for the medical services of Ross University, Dr. Sharma significantly improved the clinical, psychological, and wellness program at the university. Dr. Sharma is a PAHO consultant and has developed mental health plans for several Caribbean countries and provided training in the area of disaster management in the Caribbean, Central, and South America for PAHO. He is also a former consultant psychiatrist for mental health services of Grenada and Dominica. Dr. Sharma is currently providing mental health and psychiatry services in 2 leading private hospitals in Guyana. I want to take this opportunity to welcome both of them to the webinar. And at this point, I will turn over to Dr. Cayetano for her to actually start with the first presentation. Dr. Cayetano, over to you.
Okay. Thank you very much, my dear Ms. Jones. It's such a pleasure to be part of this webinar series. Thanks to PANCAP for collaborating jointly collaboration with PAHO in this such an important topic. And I'm very pleased to also join my colleague, Dr. Sharma, for this presentation. So we are going to be addressing mental health and self-care for the caregivers during COVID. I also want to acknowledge Dr. Anthony, who has been kind organizing all this, and I'm sure you know that you'll be receiving a lot of emails from her.
Dr. Cayetano, I think you're muted. Can you unmute your microphone, please?
Oh, I thought I was mute. Sorry, my apologies. Thank you very much, Dr. Anthony. And I was actually, acknowledging this collaboration between PANCAP and PAHO, and I wanted to thank my colleague, Ms. Jones, for such a warm welcome, and thanks. And then glad that I'm joining this webinar series along with my colleague, Dr. Sharma. So my outline of the presentation, you can see it there. So we'll go through some consideration when it comes to the COVID pandemic, disruption of services, what that means for mental health, factors impacting people's response to crisis. When we talk about promoting well-being, what do we mean, and what PAHO does, and what are the resources that are available. So as we all know, with this pandemic, I think it's very, it has really affected or impacted people's life in many, 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 many ways. And of course, we continue, not only even with the vaccine, we continue to be worried, and worried not only about ourselves, we worried about our families. Healthcare providers worry about being infected or infecting others. And we know that through different surveys that has been done, that there is an increased sense of rates of anxiety, depression, distress, and all of this cumulative effect has impact how people respond. And there's also impact to, there's also the economic hardship, the limited access to services. We know about disruption for schools, traveling, some people working from home, some people losing their jobs, their livelihoods. So, and people actually losing family members, and not only losing family member, but not being able to attend funerals or attend this, the rituals. There's a lot of things that this pandemic has done to people. And of course, clearly, there's the implication of that in terms of how the health system, health services. And there is, we don't know, I don't think we have a clear understanding of what will be the long-term impact, the long-term mental health consequences of this crisis, because it remains to be seen. It remains to be seen what will be this, what will be the effects on people's mental well-being. Therefore, there is it's very relevant that we pay attention, we prepare, we think about the importance of staying healthy, of staying well. Because it is possible that since we don't know, we have not faced this before, and it can get, people that still don't have no clarity in terms of what this will mean for them. And when it comes to services, this was a survey that was done last year, 2020. And when you look at this research, this data, we have seen that in 7 out of 28 countries, and we're talking about countries in Latin America and the Caribbean. So this is not data from countries like the United States or Canada or Africa. This is data from our countries, Latin America and the Caribbean. 75% reported that they were partially disrupted the mental health services. And you know what this means if we're talking about 75% of disruption. Emergency and essential, when we say MNS, we are referring to mental, neurological, and substance use services. 11 out of 25 countries, which is 45%, reported disruption in the management of these emergency services. And there is, including people who suffer from epilepsy, delirium, and severe substance withdrawal syndromes. There is also 40% reported disruption of medications for people with mental and neurological substance disorders. What does it mean? People need to have their medication, and if they are not able to get their medication, they have a high rate for relapse. And so we're talking about high disruption of services because of this pandemic. When we look at prevention and promotion of services, 80% of countries were experiencing complete or partial disruption of schools' mental health programs. And mental health programs are very relevant, specifically because we're talking about promotion, prevention is an opportunity for people to be able to and have clarity in terms of how to promote and protect their mental health. Workplaces, the same thing, 80%. So these disruptions are relevant to take into consideration because it stops people from having opportunity to receiving care in terms of protecting their mental health. So moving to the topic of what are these factors that affect people's response to crisis. So we don't all respond the same, and clearly we don't all respond the same to a crisis because of different factors. We're talking about personal factors, crisis event, community, and local environment. If some of you who are participating in this webinar have had the opportunity to perhaps do one of our courses, which is called the Psychological First Aid. This particular slide comes from the Psychological PFA, we call it PFA to shorten, Psychological First Aid program. And I use it because I think it's so relevant so that we all understand that we don't all respond the same. So personal factors, so it's not the same, age, education, health, previous experience, the type of exposure. So we all respond differently. And we need to keep that in mind because the social determinants of health determine sometimes how we respond to this crisis. So this is something important so that when we're making recommendations, we don't normally want to be able to make recommendations thinking that everyone is the same, everyone different. What is important here is how do we support people in protecting their mental health? Because, and this also takes me to our own well-being. So this circle, you probably have seen it before because this circle is it's a circle that we also use in some of our other presentation. And the relevance of the circle is to be able to have people take control, the importance of them taking control over their own well-being, their own health. So there's things that outside the circle that may be out of your control. They are not, maybe they are out of your control. If someone loses their job, if someone have, with COVID passed away, died, if, how other people react, how the response we're getting from the authorities, those are not necessarily, we don't control these things, similarly, like, when you talk about the weather, for example, we don't have control over that. But we do have control over, and we all know that, how we respond to others, whether or not we take steps to prevent infection, whether or not we take steps to empower ourselves, whether or not we take steps to protect our own well-being. We have control over that. Sometimes we tend to forget, but we have control over that. And the other importance here too is that before you can help others, you need to look after yourself. In the same way that a car needs fuel to drive, you need to look after yourself and keep your tank full so you can keep going. Helping in the COVID-19 response is a long distance. And so you say it's a long distance race, not a sprint. So pay attention daily to your well-being. And this slide comes from another presentation, doing what matters in terms of stress. And here, what we want to promote is, if you have a vehicle, you don't necessarily put in fuel every day. You put in fuel, maybe, I don't know, depending on how long you drive. But you every now and then you want to make sure that you have sufficient fuel so you can drive that vehicle. But of course, there is time when you need to send the vehicle to the mechanic, and there is time you have to stop. And this is the same thing when we think about our body. We need to be able to take time to look after yourself, because there's no response without you, without us. So if you want to stay well, you need to pay attention to your well-being. You need to be able to keep that in mind. And sometimes we tend to forget, the importance of taking time off, of taking vacation, of re-energizing, looking after ourselves. This is definitely very important. So what are these considerations and recommendations for protection and mental health care of healthcare teams? So this is, WHO makes an emphatic call to ensure the safety of health workers, to preserve the safety of patients, the people that you're serving. So it is important. So this is something, a recommendation, especially in this crisis, that there's in order for us to, we need to be able to continue providing services. Healthcare teams need to have ongoing training. We need to make sure that there's opportunity for promotion of mental health. And it's not just that we want to encourage training or encourage promotion of mental health, the importance of the organizational strategies. Dr. Anton, you have to tell me when it's time to switch cameras now, okay? Because I think it will be time for us to do the poll.
Yeah, the poll is up.
It's up?
Yes, it is up.
Okay, so I stop presenting, right?
Right, so you have on the screen some questions for the poll, and we would ask at this point in time if you would kindly respond to the poll. Thanks. Claudina, would you like to review the poll, the response from the poll before you continue with your slide?
I'm trying to look at the poll. I'm not able to see it. One second.
You're not seeing it? It's on the screen right now.
Sandra, I don't think it's activated. I'm unable to click on a choice. Timothy, can you check?
So Sandra and Rosman, organizers and panelists don't vote.
Okay, thank you.
But I'm unable to see it.
I'll show it to you, Doctor, in a minute, Dr. Claudina. I'll close the poll in 1 minute, maybe less than a minute, and I'll show the results.
Okay, so there you have the results, Claudina. So do you want us to go ahead and review the results before you continue?
It will be great. I'm not able to see it, Sandra. Please go ahead.
You're not able to see it?
No.
Is everyone seeing the poll questions? The response, I should say? So it is saying that, so the question was, what are your values in doing this work? And then we have idealism, 4%. Advocacy for people in dire situation, we had 57% responded. For my passion, we had 36% responded. Seeking justice, 4%. Financial gains and the status, we had 0%. So we have that the majority of the poll takers saying that they are, what are your values in doing this work, is their advocacy for people in dire situation. Yeah.
And the second one?
The second one is for passion, which is 36%. The first one was 57%, and the second one for their passion was 36%. 0% for financial gains, which actually show that people are into this for the caring and for advocacy and just reaching out for those who actually need the service.
Thank you, Sandra. This is very important. And you may ask yourself, why are we asking you these questions? We're asking you this question because when you get distracted, when you get irritated, when you're stressful, when you're under a lot of stress, you need to keep, if you need to be grounded, stay grounded to think in terms of what your values are. If you're clear in terms of what your values in doing this work is, then you know that it's your passion. It's because you're advocate. So there is times that when you're under a lot of stress, you tend to forget all these things, you know, because you're focusing on others, you're focusing on what they have done to you, you're focusing on the injustice of other people and how that impacts your mental health. But you need to be able to go back to your values, because it's about you. Remember, we talk about the mental, protecting yourself. So it's about yourself, it's about you in terms of how do you respond to a situation. I need to know if am I sharing my presentation?
Yes, it is on, but it's not. You need to put it in the presentation mode.
Okay, 12. Fabulous. Okay. Great. So we were talking about what are these considerations in terms of the recommendation for protection of mental health care, of healthcare teams. We know that there is so much stigma when we think about mental health, but then this is the importance of training. And training, when we talk about training, has to be ongoing, especially in the workplace. And we're talking about training, not only training while you are, you know, workplace, but even, you know, undergraduate, graduate in graduate education. There is opportunity. This is a great opportunity for people to start to understand what are the strategies that they need to put in place to protect their mental health. You need to be, you know, thinking about developing the skills. What are these competencies that are relevant, so that people can make, so it becomes easier to have the conversation about, you know, protecting and taking care of your mental well-being. Promotion, that's another thing. That means that we're going to be looking at how the organization, how the team, how you individually, how your team is working to promote your mental health. And then, you know, we talk about your family, your community. The organizational strategies, that's definitely still it's not something that it's happening as much as we want to, but it is definitely very important that the conditions that people are working, it's not just paying attention to the to the infrastructure, but we also want to make sure that the working conditions are safe and healthy, that both this attention is keeping to both physically and psychological health. So it's not that we want to have access to you know, physical health, but that they also give you, you know, there's insurance, there's protection of mental well-being. And sometimes people are scared to talk about if they suffer from depression or anxiety, because of they may be penalized, especially if there's no strategy within the organization to protect them. So we already did this. So it's important. Why this is relevant? Because we know of the impact, especially, you know, when it comes to this pandemic. Prior to the pandemic, in 2009, this is US, this is now from the estimates of the, you know, in the US, we're talking about 35 to 54% of clinical professionals were experiencing substantial symptoms of burnout. After September 2020, this has increased, and if you notice, almost doubled. And we know of so many people that even in the Caribbean that are reporting and experiencing high level of stress and even burnout. So we think we're looking at, you know, 76%. And when you think of 76%, you know, it's almost like 2 in every 10. It's a very high number. Now, it's very important to distinguish the difference between stress and burnout. Why? Because this is an opportunity for people to make a stop, to say, you know, I need to remember when we talk about fueling, re-energizing. You need to understand yourself. You need to know what it means to you when you're going through different symptoms. So, sometimes people become exhausted and tired. So if you see my screen, on the right-hand side, you have the circle of the middle is burnout. When you burn out, you're not efficient. People becomes irritable, miserable, and this, the cynicism, the exhaustion, but they continue working to their own detriment, and sometimes to the detriment of their family. So I think it's important that, as much as, if when you talk about your values in doing this work, if it's about advocacy and if it's your passion, then take time to be able to understand what is happening to yourself, because you do not want to be continue working if you're not being efficient, if you're not being if you're exhausted, and then you become cynical with people. So what's the difference? The difference is that we all experience stress, we all get overwhelmed, we all have a sense of urgency to do things. And then when you're having a lot of stress, especially at night time, you feel tired, loss of energy, you don't have the same energy like in the morning, you're feeling a bit anxious. You know your body. But burnout is different. Burnout, it really takes a toll on your system, on your emotion, and that can lead you to feel depressed. That also affects your motivation to do things, your sense of feeling helplessness, your sense of being hopeless, your motivation, and you become disengaged. So it's important to know, oh, this is it. This is I'm not myself. This is not good for me. So you need to be able to, at that point, to take time, because if you continue like this, chances are people are going to crash. This is a very this slide, most people are familiar with this. So this is to show, between your stress level and burnout. But a lot of people probably have seen that, how it affects your performance here, because it's not the same when some people will function quite well under stress, and they say, you know what, I feel like I can do that, but not under so much. Because if you look at this curve, then it's easier for you to get burnout and then start to have other, I think it's time for the other, no, it's easier for you to get burnout. So why your mental health matter? It matters because, improves your job satisfaction, your productivity, your performance, and it also helps you. I put here your staff and team, but I want to make sure that it's not only your staff and team is important, because you want to have that culture, within your organization. But think about your family. Think about the people who will be beside you when, when you're not doing well. Your family. So they also can benefit when you are feeling well, when you're paying attention to your mental health and the impact that it has, if you have the organization. So it does definitely make a difference. So as managers and as leaders, your mental health matters. Your mental health is definitely very important. Not because you're representing your organization, not because you are also representing yourself. You are also working in a team, and you want to have a positive impact in that team. So you want to be able to, and even within your family, you want to be able to have, serve as if you're a manager, so you want to serve as a role model, and that you too need time you need to take time to take care of yourself. Then you will encourage others to do the same, just like you do it for yourself. No one is perfect, no one is eternal. We are we do have times when we need to take a break, so all of us. And then your sense of job satisfaction and success and well-being is important, so you can have, because what you want is to have a more positive impact on the organization, the people that you work with. So this is why it's so important that you don't neglect your mental health. In PAHO, most people are familiar with the wording that we always say, there is no health without mental health. It is because that's what, and it is true, there is no health without your mental health. You need to pay attention on self-care. You need to pay attention on paying on on your well-being, because that's definitely will impact how you're working with others. So clearly, we start with yourself. You don't start with, you start building that understanding about your well-being, and then taking it to the workplace. And this is why I think we need to look at that. So this slide here is just to do kind of like a self-reflection, and you want to see where you are at some point. In terms of if you're struggling, or if you're feeling frustrated, or if you're actually feeling that you're thriving. So there is times when you're actually struggling, and you know that you're falling behind in your work. You know that there's some days when you're not getting anything that is needs to be done. So you look at this where you are, or maybe at times you're just feeling frustrated, and then you're feeling that you're not as engaging, you're not getting so much more satisfaction from the work that you do. But bottom line here is where you are, what it is that is happening, so that you'll be able to know what steps you need to take to stay well. So what you should be doing, if you're struggling, you want to be able to, if possible, seek advice. You want to be able to have strategies to take care of yourself, so that you can regain back your sense of well-being. And if you're frustrated, it's important that people invest time and energy in prevention. If you're feeling satisfied and you're feeling successful, you still need to invest time in paying attention to your mental health. Why? Because you want to maintain that well-being. So how do you sustain it? So you want to be able to every day you're paying attention to your well-being. Every day you're doing something that sustains you. And that's the challenge sometimes, that if you're not aware of what is this emotional, what happened to you emotionally, then it's difficult to know what will be the next steps. Or if you know what will be the next step, you can also ignore that and don't pay attention to yourself, which could, which will have some serious consequences. So your well-being matters. When we talk about well-being, we're talking about promotion, protection, and prevention. And then we're talking about what the things that you need to do at an individual level, and then the things that you need to do at the workplace. It's also very relevant to focus on, when we say good health, we mean that you need to be able to pay attention to your diet, to your exercise, to your sleep. Why? Because having healthy habits helps you to stay well, helps you to be able to do things. If you have, good night's sleep, if you have a balanced meal, if you exercise on a daily basis, these are what we call, the risk factors that you want to be able to do the things that helps you to stay well. Do I continue? I probably do. Okay. And so we talk about stress, what stress can do to your body. We talk about understanding that, building awareness, having clarity in terms of what are your physical symptoms, what are your physical sensations, what things are affecting your mind. Because when you're feeling stressed, I show you that curve, then it's easier to move to become burnout, and then from there, having anxiety or depression, becoming distressed, and your ability to function is not the same. So you're not good to yourself, you're not good to others. So mental health, as I said, there's no health without mental health, so we need to invest in our mental health. Organization is to invest in people's mental health. So you need to build strategies to recognize what are the signs that affect your mental well-being. And importantly, how to start the conversation on mental health. Remember, here we're talking about mental health, not about mental disorder. And this takes us to resiliency and recovery, because that resilience is that ability for us to bounce back and grow after dealing with adversity and challenges in life. So it's each one of us, we are, as I mentioned, remember we have different factors. Not all of us bounce back the same. So you need to have an understanding of what makes you strong, what are your strengths, because we face these different challenges, but we have to know, you have to know your resilient strengths, and then you have to keep investing in that, because that's what helps you so that you can continue on journey to living a life that is well balanced. So this is definitely important. Recovery thinking is an important approach to support others achieve their goals and aspirations. This is definitely important. So we are moving now. I need to go a little bit faster. I don't know if we have another.
Yeah, just if you could wrap up quickly.
Yeah, I want to, yeah, maybe we could just leave the question for the end, the poll, or
is there another poll? Do you have another poll?
Is there another one? But let me go through this quickly. This is, I probably only have two more slides. So this is just to share people what PAHO does. So PAHO, we have this web page on mental health and psychosocial support in emergency. It's a new web page that I encourage you to explore in terms of looking at different materials, communication that are available. We also have the virtual courses. We have, we do training, capacity building, provide technical support. We support countries in developing MHPSS technical working group. We support countries in developing countries have disaster plans, but we want to make sure that in this disaster plan, they include MHPSS. We also, because we have this capacity building, like, when people have done a PFA training, it's not just to do the psychological first aid training. After that, we want to make sure that people get other training, specifically when it comes to, this is just a sample of one of the training we did with the countries, that they learn about what is MHPSS, the importance of self-care. Here we are talking about another publication that we have, Doing What Matters in Times of Stress. So we do training on this publication, and through the work that my colleague Elisa Prieto is doing, she had made an adaptation of this publication for the Caribbean. It's relevant. It teaches about grounding. How do you, what are the strategies to be able to continue finding ways to deal with stressful situations. So the other one, so as I mentioned, that same booklet have these 5 techniques: grounding, unhooking, and acting on your values, being kind, making room. So these are very relevant training. Basic psychosocial skills is another guide that we have from PAHO that actually we take, do trainings on this one. I want to, from all of these resources that I'm presenting here, this one, Stronger Together, is, and I'm sure Sandra familiar with the Stronger Together campaign. The Stronger Together campaign is for the Caribbean. I actually work with Elisa and the Caribbean Development Bank on putting together all these materials. So if you go to Stronger Together, it has there the psychological first aid, virtual course, and materials. It's full of different communication materials for people, especially during adversity. I finished right here, so thank you very much, and it's definitely a pleasure for me to be part of this webinar series. So I stop.
Thanks, Claudina. And then we have now on the screen a second poll. Shanti will be giving us, will let us know when she's going to close the poll. We will look at the results of the poll and then very quickly go to the second presentation by Dr. Sharma. So you could let me know, Shanti, when the poll will be closed.
So we could go through that very quickly and sort of like relax the brain a little bit. How comfortable are we sharing problems?
Yes.
And
comfortable, that's good. Not comfortable, non-com. So we got about a good number saying yes, but we also have a fair number saying no. 4353. That makes sense, because we're not always very comfortable sharing to colleagues. Let's go to the next one. because of privacy issues and feeling that our problems will go wrong. So seeking help now. So we're not that comfortable sharing, though there are some people who share well, good for you. And not bad if you don't share well too, but tells you a little bit about yourself. Seeking help in distress. Comfortable is 55. Good for you, all of you who are able to share and seek help. Sort of midway neutral means you're not thinking too much about it. So please use reflection. Reflection is a powerful technique. Dr. Cayetano talked about some very, very good techniques, and reflection, we know we actually use it a lot with our medical school. Even has a program where they go into communities and reflect on what they see. Good, so that's not too bad. We got a good number, 69, nearly 70% comfortable sharing and a neutral response. Good, I like that. Healthy. Next one. All right. What would you choose if you had to seek help, share personal problems? Okay, so we can close that to move this along. And psychiatrist, so nobody wants to see the psychiatrist. 10% counselors get a better number. Religious leaders, we got some people share there. Friends, a friend is really a powerful resource, powerful resource. Let us all have a good friend who we can trust, can confide. And this friend could be a parent, a spouse, so family member. So we got a lot of folks sharing within the family and in the social setting. More than I would see the numbers who would share in sort of a social setting, much more than for the professionals. So something to think about. But we do have professionals who are trained to respond. I think that may be it, or do we have one more? Oh, yes. What do we have? What do you have at work? Do you have any programs at work? A counselor or psychiatrist, employee assistant programs where the employees will have a program that's confidential, or there's nothing? Okay, we can vote on that. Yes. Counselors, you have good at work. Psychiatrists, some people have. EAP, I'm so happy to see that. I'm a great believer, and we need more of these EAPs. So I'll be talking just a little bit about resources, but we see a big number of no support. And Dr. Claudina will be taking note of that, because that's what PAHO WHO does, to provide support, look at how we can train, encourage people to get into that support system. So let's go to the presentation. Is short. I don't have much time, but I really wanted to talk about resources which would help in a particular aspect of ourselves, which is our resilience. And these are the R's of resilience as we learn to recover, regrow, reprogram, relearn, and remain, because we don't want to run away from our stresses. The next slide. So resilience is a powerful factor within us that we must tap into and strengthen. So you can change the slide. And so next slide. Right. Resources. Here is a very good resource. We're talking about resources for resilience. So how to survive against all odds. One of my favorite shows is to look at those programs where people survive, real stories. I find it fascinating that the human spirit is so strong, and the life spirit and the life force is very strong, that even in an ant, survival is very important. So Andrew Marr in this program for the BBC traces 70,000 years of history with movement from Africa, which is probably where we all originated, and then spreading around the world, adapting against odds. Very useful to look at. So to make a note of that resource and have a look at that program. It's fascinating. Next slide, please. And for those of you who like reading, these are just some of the books that talk about survival. And then one book actually is titled Survival. We know about the Holocaust. Alone on the Ice, a true story, the Slovakia experience, which is pretty horrible, and Afghanistan, which is still happening, and it's just awful and very, very sad that the situation is so troubled for people in that area. Cambodia, that's a horror story, and the Bible we all refer to is a remarkable story of survival itself. The Bible, not in the Bible, is actually the Bible. And this is a book that talks about how the Bible survived efforts to have it not published and be available. So I think that's the greatest survival of all. And let's go to the next slide, as my battery is about to run down. This is a crisis, so we gotta stop this at the moment. So next slide, top. Good. So we're looking at some of the traits that will help promote resilience in ourselves. And these are some of the top traits: being able to control our emotions, not getting too labile, jumping from grief to excitement. So stability of emotions, being able to have confidence in ourselves. And I'm sure all of you are very confident. Have a self-value system, believe that we are valuable, we have self-worth. The systems don't encourage too much of self-worth. There's so much putting down of people. Being able to understand, empathize, the whole new wave of thinking about emotional intelligence, being able to empathize is so powerful. Faith, having a faith source, having a spiritual support system is very powerful. And of course, humor. Humor is one of the things I turn to a lot. And as you can see in the next slide, we're talking about using humor for resilience. So every time you use humor in a difficult situation, rather than respond angrily and drive your catecholamine levels up, we can relax and laugh with the persons who might be sharing difficult times, or maybe we're in an annoying situation. Try to find some humor. Next slide, Doc. So these are some of the summary factors which will help our resilience. And we're looking at positive outlook. Dr. Cayetano talked about taking care of ourselves and yourselves. Problem solving, so don't let the problem fester. It's like an ulcer, it's like an abscess, leaving it there, it's getting worse. Find meaning and purpose, and it's wonderful to see all of you put in that there is significant meaning to your work apart from just the financial benefits, which is important. We must know that. But with that slide she had, didn't give that second choice. So you had to choose the best, and you did choose the best. You're finding that social support system, which we'll talk about that in a few minutes. Next slide up. So we know that we can build resilience by resistance. So we can actually have physical resistance, as we saw in the COVID situation. There's a lot of physical resistance to the virus by lockdowns, by restrictions on travel. So there are a lot of barriers that were put up, but those barriers also had a price with it. Children got emotionally distressed, families were in distress, as one as Dr. talked about. So vaccines are helping us now to become more resilient physically, and I'm a great believer in natural resilience through immunity. So we got to keep our bodies healthy, use the right food, use the right vitamins, and build up our immune system. So we got to resort to immune strength, which is naturally inbuilt in us. Doc, next slide. So just a last few words in terms of resilience. It's by looking for help, seeking the help, and help is there. Finding the courage to seek help, overcoming some embarrassment and shyness to share problems, and look for the resources. Resources are there. So just a few words on resources before I close. Next slide, Doc. And resources can be either governmental, where we have mental health clinics and walk-in centers. And I'm glad to see that some places have an EAP program, and it's a very, very valuable program. So we must encourage our system to develop those programs. Rest and time off from work, it's not a luxury, it's a necessity. We also have to educate our employers that it's good for wellness programs to be put into place in the workplace, And there are also, Docs, next slide, non-governmental organizations, which are many, thankfully. These people are a blessing to us. There are many, many of them. I just put up a few here in terms of Red Cross, the church, spiritual help. For those people who may not have access to help, we really want to try to develop more. I know PAHO is working to that in many countries like ours in Guyana, where people are in the hinterland. They find it hard to reach the city to get therapy, to get counseling. One way of getting that to them is by telecounseling. And last slide. So that's for me, and I thank you again. Thank Dr. Anthony and all the coordinators for having me on. And I think we have maybe just a couple minutes, Doc, for questions.
Excellent. Thank you very much, Dr. Sharma. And I want to thank both of the presenters for their excellent and valuable information and the resourceful presentation. Thank you, Dr. Claudina, for reminding us of the implications of the pandemic on mental health and the health system, and for highlighting the manner in which mental health services and interventions are disrupted in countries. I think that was an excellent survey and the results. And caring for caregivers is critical, and consideration and recommendations for the protection as well as mental health care for the healthcare team was extremely useful. Dr. Sharma, thank you very much. I think the poll was also very excellent. Thank you for the creative manner in which you highlighted and presented the services and resources for resilience building. As you mentioned, resilience is to survive against all odds. And so thanks for reminding us that humor is a powerful force of resilience. I will now open up for some quick questions and comments. Just a gentle reminder that you can type and submit these in the chat bar of the webinar panel. I don't see any questions at the moment. I don't see any question. Timothy, Shanti, you could tell me if I'm right, but I'm not seeing any. Yeah. So please feel free if you have any questions, comments, or any information that you would like to share with the panelists.
I think Dr. Cayetano covered quite a lot, so we're good. I think a lot of information to take in and reflect on, so that's good.
Exactly, a lot of information indeed. Okay,
And
so
since it's Friday, since it's Friday, it's an excellent opportunity to reflect about how do we continue protecting our mental health.
exactly. Do we have any more polls, Shanti? Is this the end of the poll? I think that might be the end of the polls. All right. We will be sharing, yes, there is a question asked if the presentation will be shared. The presentation will be shared, it will be posted on the PAHO and PANCAP website. And so not only will you have access to the presentation, but you'll have access as well to the recording as well. All right, so we are, I guess, just about at that time where we are coming to an end of the webinar. We don't seem to have any questions or comments. So on behalf of PANCAP and PAHO, I would like to thank both the presenters for participating and for the excellent and informative presentations. I also want to thank PANCAP for the excellent collaboration with PAHO. And thank you all the participants for participating in these webinars that are jointly put out by PAHO and PANCAP. Thank you very much for your ongoing support. I would want to take this opportunity as a gentle reminder that there will be a post-webinar evaluation. We will appreciate your support in taking the time to actually complete the post-webinar evaluation. As I said earlier, it gives us insight and information as to improving the webinars as we go along. I also would like to share with you some upcoming activities, and the two we have coming up for July. The first is a share fair focusing on the use of dolutegravir as a preferred first line ARVs for HIV, and this share fair is scheduled for the 16th of July. So please save the date as the invitations will be sent shortly. And the other webinar is going to focus also on dolutegravir, and it is scheduled for the 30th of July. And similarly, the information and save the date will be shared by PANCAP. Please continue to follow us both on the PANCAP and the PAHO social media platforms. And access to information on HIV, COVID, mental health, and other related topics and resources are available both on the PANCAP and as well as PAHO and WHO websites, and on the PAHO Caribbean website for information and resources specific to the Caribbean. I don't know if there is any additional information from PANCAP before I close the webinar. Anything that I may have missed?
Not at the moment, Sandra, but I don't know if you're seeing the comments. There's one question from Dr. Sylvia Smith. I don't know if you can see it from your end.
No, I cannot see. So if you could, I just see just a question, but I don't see the question. Can you read it, please?
So she's asking, is there any chance the development of the EAPs can receive funding? Dr. Sylvia Smith, the EAPs.
If there's any chance of developing it, where?
Well, within the workplace, I presume. So yeah, EAPs can have funding through insurance. That's one of the best ways. And then, for example, in Guyana, there's a National Health Service, so it can be linked to an EAP program, which provides care, especially in terms of emotional support. So when we talk about EAP, we're talking about the clinical emotional support, which is often lacking in the workplace. And then sometimes people can't afford, or sometimes people may not want to go into a government clinic. So there are a lot of things that need to be put in place for a good EAP. One is ensuring of confidentiality, because people, when they're sharing information at the workplace, they often feel that it's going to go out to HR. So there are programs that can even be done, not necessarily in the workplace with a counselor there, but externally would be considered EAP. For example, I know that Exxon in Guyana has a program where they utilize some of the counselors in the country for running support for staff. I've utilized sometime too, so it's really good to see them using that. We must get more into this in the Caribbean. You know, these are the good things that help our people. Dr. Cayetano, you want to add anything to that?
No, that was the, am I muted? Unmuted?
No, you're okay.
No,
We're
no, thank you. No, that was actually what we wanted from you, Dr. Sharma, to make sure that you provide information on the services that are available. I was looking at one of the questions. So, you know, when we ask people about whether they seek support, more than half of people who join said no support at all. And that's kind of worrisome in terms of, one, that the culture of seeking support is not there. Two is whether there is resources available for people to seek support. Because one thing is, you know, when you talk about access to services, one thing is that, you know, you want to make sure that the services are there for people, and then that we need to guide people or provide them the information when to seek support and where to seek support. And we need to build some kind of trust. Not everyone is comfortable to go, and like you were saying, in terms of if there is no confidentiality, they don't feel safe and comfortable, so all of those things. So I think it's relevant that you know, we talk about what are the resources that are available and what improvement needs to be made for these resources so that people can have the culture of feeling comfortable to seek support. Because and not all the time you need support. When we say, when you need, it could be just to talk to a therapist, or just, you don't need, not everything is about like medication. It could be just conversation, just bounce back, just trying to clarify some issues that are not clear to you. You don't know how to handle them. You know, people are dealing with difficulties at work or at home, and sometimes you just want to get a third person who is not part of your some circle to ask questions. So I think this is definitely an opportunity to build that capacity, to build the comfort of starting this kind of conversation, for sure. Thank you.
Thanks very much, Claudina and Dr. Sharma, for those two interventions. I think Dr. Smith would like to speak. Perhaps maybe Timothy, we can release her mic and
Unmuted, Sandra. Go ahead, Dr. Smith.
Hello?
Hello?
Go ahead, Dr. Smith.
Yeah, I didn't actually want to hold anyone up. I think the question has been answered quite fully for me. Thank you. I mean, I echo everything that's been said by your speakers about people's reluctance to possibly share and seek support. It's not necessarily within our culture to do that, although that's improving. But I also think if lots of workplaces don't have the available support for employees, that's something that really needs to be looked at, because that's probably going to be the best place to locate some of those support services. Thank you.
Yeah.
Can I add to that? And I think it's an excellent intervention from Dr. Smith, because, you know, when you look for a job, sometimes people just go for a job and they're not looking at what are the other benefits. It's no longer good that they pay you Social Security. It's always good. Those things your benefits are important, but that there is opportunity for employment assistance programs, EAPs, that there's opportunity for you to be able to, Mental health at workplaces, as you rightly said, Dr. Smith, it's becoming more and more popular. People are talking about those things, and we need to be able to demand that people take pay attention to our mental health, protecting ourselves. Thank you.
Thank you.
Okay, thank you very much. Thanks very much, Dr. Smith, for that question. I don't see any additional hand raised. I don't see any additional questions. So at this point, I would once again like to just thank the presenters, thank all the participants for presenting. Just a quick reminder of the Share Fair that is coming up on the 16th of July and another webinar on the 30th of July, both of which will be dealing with the use of dolutegravir as a first-line medication for HIV. So thank you very much. And if there's no other questions, comments, or concern, I will bring this webinar to a close. Thank you very much.
Thank you very much. Goodbye, everybody.
Have a good weekend, everyone. Thank you. Bye.
Thank you very much. Bye.